The continuing spread of COVID-19 will only fuel the rise of more variants. US Food and Drug Administration Acting Commissioner Dr. Janet Woodcock said on Monday. With so much virus replication going on in many parts of the world, it is like a giant petri dish, and so they are going to be splitting up variants of all time because there is so much virus replication. We just have to be on our guard, Woodcock said. Variants may easily evade some current antibody treatments like Bamli and Bim, but vaccines so far appear to protect well against variants. Vaccines elect a broad immune response. We have already seen that with the variants in the United States, and that it's no longer effective against a number of variants circulating in the United States. This was expected with the monoclonals because they are just monoclonal, of course, and so they have executive specificity and they are vulnerable to all type of shift. The vaccine is more robust because you are having a human response, a polyclonal response. Woodcock said increased viral surveillance is important in understanding what need to be done to combat variants. What's happening now is that all the talk about how people were not going to get shots and were not going to be involved. Italy reports 144 coronavirus cases, and this is a case at rest of Florida records 3,841 coronavirus cases. People over 65 years of age, over 80% have now been vaccinated and 66% fully vaccinated. And there is virtually no difference between white, black, Hispanic and Asian American. Students 16 and older who attend a public school in county can now get the COVID-19 vaccine on campus. And Pfizer vaccine will also be offered at various schools in Pompano, Coconut Creek, Deerfield Beach. Italy reports about 144 coronavirus cases, and on Saturday Italy reported 226 coronavirus deaths, 12,965 new cases. And 6 Italian regions will remain under high COVID restrictions from Monday. Number of coronavirus cases in India reported more than 350,000 and 18,000 fresh COVID cases in Delhi and 448 deaths. 3,417 deaths in country and 1.99 crore total cases. And taking the total tally of death to 2,19,000. COVID-19 cases are rising. Day by day. And if 3 lakh 50,000 people will get infected per day, it will take about 4,000 days for the whole country to get infected. But the number of cases are rising magnitudely, so I don't think 4,000 days will be utilized. The whole country will become infected in few weeks only. And even smaller countries have decided to close borders with India due to immense rise in COVID cases. Tamil Nadu imposes fresh restrictions for 14 days from 6th May. Karnataka reported 37,000 cases and 217 deaths. Maharashtra daily cases have risen to 50,000. There is immense black marketing and hoarding of various products. Two IPL players also test positive. Over 4 lakh cases in Delhi and 3,673 deaths on 1st of this month. Banks are hiding the coronavirus deaths. Even small states like Punjab are witnessing 6,798 new cases and 157 deaths in last 24 hours. 1.2 lakh COVID cases a day in second. Were expected, but it is showing more than 4 times than expected because the expected number of cases were too less mentioned. You can't enter various borders without showing any kind of reports and certificates. Even if those reports are 20 days old, it doesn't matter. But sometimes they can demand a recent report also. No state will feel safer. The number of cases will rise in each and every state. Spike protein of novel coronavirus play a key role in illness. SARS-CoV-2 distinctive spike proteins have been known to infest its host by latching on healthy cells, but scientists have now found that they also play a key role in the disease. The paper published in the journal Circulation Research showed conclusively that COVID-19 is a vascular disease, demonstrating exactly how SARS-CoV-2 virus damages and attacks the vascular system on a cellular level. The findings help explain COVID-19 wide variety of seemingly unconnected complications and could open the door for new research into effective therapies. A lot of people think of it as a respiratory disease, but it's really a vascular disease. said Uri Manor, assistant research professor at the Salk Institute in California. That could explain why some people have strokes and why some people have issues in other parts of the body. The commonality between them is that all they have vascular underpinnings. The study for the first time revealed the mechanism through which the protein damages vascular cells. The mechanism was not understood before. Similarly, scientists studying other coronaviruses have long suspected that the spike protein contributed to damaging vascular endothelial cells, but this is the first time that the process has been documented. In the study, the team created a pseudovirus that was surrounded by SARS-CoV-2 classic crown spike proteins but did not contain any actual virus. Exposure to this pseudovirus resulted in damage to the lungs and arteries of an animal model, proving that the spike protein alone was enough to cause disease. Tissue samples showed inflammation in endothelial cells lining the pulmonary artery walls. The team then replicated the process in the lab, exposing healthy endothelial cells to the spike protein. They showed that the spike protein damaged the cells by binding ACE2. The binding disrupted ACE2's molecular signaling to mitochondria, causing the mitochondria to become damaged and fragmented. Previous studies have shown a similar effect when cells were exposed to SARS-CoV-2 virus, but this is the first study to show that the damage occurs when cells are exposed to the spike protein on its own. So, coronavirus is not a respiratory disease, it's a vascular level disease. That's why it causes brain stroke and other kind of blood clots also. Negative report of coronavirus is not sufficient. Even then you have to remain in quarantine. Because RT-PCR provides false negatives. And why is it happening? Because the accuracy of COVID-19 detection is returning false negatives, and this has more recently been blamed on test purported inability to detect new coronavirus variants. People who are getting tested may show symptoms of COVID-19 even though their test gave negative results. In other cases, people are unable to get tested due to shortage of testing kits in other parts of the country but are showing COVID-19 symptoms. Either way, the gatekeeping of the RT-PCR test is providing cumbersome for many to become navigate. People with RT-PCR negative kits for COVID-19 were being denied admission in Delhi hospitals despite having symptoms. No patient requiring medical aid should be denied treatment, but it is not possible at all because number of patients are too high than the number of beds, and they should have no other option but to deny. It mostly junior doctors who meet patients when they first came to a hospital. When a person comes with fever and shortness of breath, as senior resident, I knew it can be a number of things. So COVID-19, heart attack, dengue, scrub, typhus, chikungunya, even acid reflux. So clinical judgment here is very important to be able to tell the difference. But since there are mostly junior doctors on the front line and the system is overloaded, administrators have insisted on lab parameters like RT-PCR test is ordered to be admitted. What if did not have a reliable RT-PCR test for COVID-19 would not, as doctors still have treated people for the disease based on the clinical, because they believe in RT-PCR only because it is an economical kit imported from China, and they can paste pictures of lion and spectacle also, and they can promote themselves like that way. So they used to buy these kits at the cost of 300 rupees and then tell the patients, okay, we will test you at 9:27 a.m. and provide you the report at 9:27 p.m. Most of the time they tell them that your oxygen level has reached 92.7%, so you have to be shifted to big beds inside big hospitals, and you should buy big oxygen cylinders also.